Hello, Assalamu alaikum. This is me, Dr. Jahangir, and you are watching me on my YouTube channel, FCPS Smart Study by Dr. Jahangir. Today, we are going to talk about a very common complaint, that is cough. So, a patient comes to you with the chief complaint of cough, and I have seen a lot of patients. Now, the cough is of two types: cough due to upper airway and cough due to lower airway. Now, this is very common mistake that we do in our ward, in our ER. A patient comes to you with the chief complaints of cough. The focus lies in the throat usually, and you are treating the lower airway. You are thinking about something in problem in the lower airway, like asthma, like acute bronchitis, and the problem lies in the throat. The cough variant that we call the irritative cough. And this was actually a patient that was already diagnosed case of ischemic heart disease, CCF, and he was having a dry cough, and he came with the chief complaints of this dry cough. He was started on ATT for 9 months. He was started on ATT, anti-tuberculosis therapy, for 9 months. And this is the reason that now we are getting the XDR and the MDR TB, the normal drugs that are not working on the patients. So what was the problem with that patient? After completing the course of the TB medication for the 9 months, there was no improvement. During the therapy, no improvement. After the therapy, no improvement. And when I took the history, he was having post-nasal drip. He was having DNS, he was having chronic sinusitis, and he was having post-nasal drip, and that was causing irritative cough, and the focus was lying in the throat. So he was having actually post-nasal dripping, and that would irritate the throat, and he would cough. So by adding simple antihistamine and strepsil, his cough was improved. And he was operated for the DNS. So you see, a simple thing, but your management is totally changed. A very simple thing, you will get the irritative cough, and you first exclude the irritative cough. You check the throat and you ask the history of postnasal drip. Well, another thing that is related to this is that is in females usually. There was a young female of 29 years age. She came with the cough, and there was no postnasal drip, no family history of asthma or allergy, and history was not conclusive of asthma or pneumonitis. Chest was clear, x-ray was clear, throat was clear, no tenderness in the sinuses, no history of any drug use, no history of any GERD, that is gastroesophageal reflux, that can frequently cause a dry cough. But the dry cough was not at night, that was during the day. And while taking the history from her, she was having coughing in between during our conversation. And the thing that came to my mind was, she was saying there is something in my throat. Now when the person complains if there is something in my throat, now the coughing would always be in order to clear the throat. The patient coughs to clear the throat. So this is a common case that is you will see in the female, that is called globus hystericus. Globus hystericus. There is nothing in the throat, but the patient is complaining of something in the throat, and the patient coughs only to clear the throat. So this type of cough is absent during sleep, during night. So this differentiates it. The irritative cough will be present during the day when the person is awake. Asthmatic cough will be during, an allergic cough that will be during the night. So that can differentiate between the two. So this patient was started on the SSRIs, and after 1 month the cough improved. After 1 month, the cough improved. So the take home message is, irritate your cough, always exclude upper airway. Always exclude the upper airway. Upper airway problem is a cause of cough. Then proceed downward. Second is globus hystericus in female. Third is when the person complains of something in the throat and cough, then the cough is secondary to clear the throat. So find out what is the problem in the throat. If you can see there is a problem in the throat, treat that. If you can't see any problem in the throat, globus hystericus, take the history of depression and anxiety and treat accordingly. So what is the most common cause of dry cough? Answer is asthma. 50% of the cases, the cause of the dry cough is the asthma. The rest of the 50% of the cases, 25% the cause of the cough is rhinosinusitis and postnasal drip. And the rest 25%, 15 to 20% the cause is GERD. The cause is GERD. And the rest percentage that is taken by the AC inhibitors. The AC inhibitors. The AC inhibitors, these drugs. The AC inhibitor, these drugs. And a very small percentage that is taken by these psychiatric disorders. But in our setup, the psychiatric disorders, the asthma, psychiatry, and irritate your cough. But never forget to take the history of GERD. Thank you for watching. Press the bell icon so that you can get the notification of my new video, and we will discuss the common symptoms and their management. Thank you for watching.